We've been speaking with the FDA to facilitate the discussion of this and other issues. As regards Secretary Kennedy, he did promise to come back, and we have requested that he come back and testify. That was something that Senator Murray mentioned. No, it's in the process. Yeah. And so now, Senator Baldwin.
Thank you, Mr. Chairman. This hearing is allegedly about protecting women. But what we're really talking about here is a Republican effort for a national abortion ban by any means necessary. Frankly, if my Republican colleagues truly cared about protecting women, they would ensure that women had the right to make decisions about their own bodies and access to comprehensive and affordable health care. We're currently facing an ongoing healthcare crisis in this country. President Trump and congressional Republicans' big, ugly bill will result in 15 million Americans losing their health insurance and cause 200 Planned Parenthood clinics to close, cutting off access to cancer screenings and reproductive health care. The 24 million Americans who rely on the Affordable Care Act marketplace are facing drastically increased costs fueled by the expiration of enhanced premium tax credits. And numbers released yesterday by CMS show that the Affordable Care Act enrollment is declining as a result. Dr. Verma, you touched on this in your testimony, but how do these Republican actions to limit women's access to health care generally and reproductive health care specifically, how does that affect the patients that you see?
Thank you for that question. It dramatically affects the patients that I see. In Georgia, we have a huge number of maternity care deserts, about 40% of our counties, and many of those patients can't get easy access to their prenatal care, their cancer screenings. I often see women who come in to deliver their babies who have not been able to get any prenatal care. And these cuts are making that much worse. And so we are creating a world where women can't get access to the abortion care they need. They also, when they choose to parent, cannot safely continue their pregnancies and deliver because they can't get the health care that they need.
We've heard a lot today of things that are not based in evidence. Here are the facts. Mifepristone has been FDA approved for nearly 25 years. More than 100 peer-reviewed, robust clinical studies have confirmed its safety. 99% of patients who took the abortion pill had no complications. My Republican colleagues are citing studies that simply don't pass muster. These studies may not be peer-reviewed or even published in medical journals. So, Dr. Verma, could you share the difference between the over 100 studies affirming the safety of Mifepristone and the so-called studies that my Republican colleagues have chosen to highlight at this hearing?
Thank you for that question. Absolutely. Just as you mentioned, we have over 100 high-quality, peer-reviewed studies showing Mifepristone's safety and effectiveness. Less than 10, 2 have been retracted to suggest that Mifepristone is not safe. One that is commonly cited and that we've heard about today, even the CEO of the Association of Pro-Life OBGYNs admitted the paper is not a study in the traditional sense and is not proof of anything. It was a policy paper that was self-published that mislabeled serious adverse events. It included routine care as serious adverse events and really falsely made claims about everything it was saying. And so, yes, the science on this is more than settled, which really does beg the question of what are we doing here today, right? The science is settled. I think any person of science can compare these over 100 studies to the less than 10, 2 have been retracted, all of which are deeply flawed if you look at them as a person of science. I think any person can say the science is settled. And so, again, what are we doing here today? And it may be that we are here today because people in this room feel uncomfortable with abortion. And that's okay, and we can talk about that, and we can have an honest conversation about that and complexity and the reasons that my patients need abortion care, but we should not pretend that this is an issue of the science.
Thank you.
I would offer that Dr. Marshall, as a practicing OB, knows something